talk about client engagement. What is client engagement? Client engagement is present when patients become actively and fully immersed in their own treatment process. Now, client engagement is extremely essential, but it's often challenging. Most therapists have a strong preference towards specific methods that they work on, specific models, specific techniques to achieve success in therapy. I've been doing this for long. It has been working. This is how I do it. Here's where you might have to adapt, and here's where you might have to involve a little bit of change in your processes. Because no matter which of these methods you use, they are not going to work if your client is not engaged. So client engagement can be broken down into 3 aspects. Make sure that you're focusing on patient-therapist agreement on the goals of therapy. Talk to them. Address this in the first session itself. Make sure that you all are on the same page regarding the goals. The second is the emotional bond that is created and maintained between the client and the therapist. And the third is the collaboration on therapy-related activities. Think about the best way to interact with your clients. Ask yourself, can I use the same materials that I was using in-person therapy? What are some of the engaging activities that I can use in my therapy sessions? What were the activities during which the child seemed to be disengaging or disinterested? What are the activities that excited them? You have to keep a note for each individual client to make sure that you get the individual response that you are seeking. Teletherapy is just like in-person therapy also in terms of it's not a one-size-fits-all. You will have to tailor your therapy sessions according to each student's goals and their needs. Now, selecting clients for teletherapy. The next step is you take a look at your caseload and you determine whether or not your clients are appropriate candidates for telepractice. Now, while there is limited research available on client selection, we can turn to our professional organizations for guidance because a lot of them have guides that would help you do this. The AOTA specifically provides a downloadable telehealth decision guide, which will help providers make decisions on whether a client is a good candidate for telepractice or not. Once we review the recommendations of our professional associations in whatever state or country that you are in, we may find we need to adapt what we are doing to meet our clients' needs. This is one of the most burning questions that I have received in my practice as a teletherapist. Is telehealth effective for low-functioning children? Is it even recommended? Now, when we talk about low-functioning children, who are we addressing? Who are we talking about? Those with poor attention spans, those with lower cognitive skills, those who are nonverbal, those who have behavioral concerns, limited mobility, and those who just might be defiant. Now, engagement and interaction with low-functioning students is very challenging. In the absence of sensory equipment that you may have used otherwise to regulate them, it could be even more difficult. And children who do not have access to these special equipment have to rely on things available at home. How are you going to help? Remember the importance of consultation. The biggest advantage of teletherapy is the constant inclusion of families and caregivers in the process. Make use of that. This makes carryover of therapy efficient as well. Parent and caregiver participation is key for teletherapy. Use a lot of modeling, step-by-step instructions, constant verbal cues, repeated demonstration of the task if needed. Instruct the caregiver on hand-over-hand techniques. Ask them to demonstrate the activities that they have had success with at home. Also, ask them what amount of support was needed, how much cueing was needed. Remember, some children might be visual learners, and this might greatly help them understand the demands of the activity or the task. You model the activity for them. Doesn't matter how long it takes. Have positive reinforcement systems in place, especially for behavioral concerns. Now, if your child has been going to school, they may or may not have a BIP in place, which is a behavioral intervention plan, if they've been seen by a behavioral therapist. If they do have that, that would be an important document for you to have access to. You can see what kind of reinforcement systems were used, what worked, what did not work. Motivate your clients with checklists, breaks. Who amongst you is like me who loves a to-do list? I love checking things off my to-do list. It gives me the greatest sense of accomplishment and achievement. Now, if you can feel that way, your child can too. Have a checklist of items. Let them check things off as they're doing them, one at a time. It gives them a greater sense of achievement. It gives them a sense of, I can do this, and I did. Of course, use breaks, use a lot of breaks, especially with the low functioning children. Now, movement breaks of any kind are essential during therapy. So you might need a movement break as well. Go ahead, if anyone needs to right now, grab that cup of water, go walk around the room. Oops, sorry. Use incentives, rewards, use the most loved items as an incentive or reward, and also remove highly preferred items or those that might be a trigger for them or might prove to be a distraction. So make sure while you do have reinforcements ready, the parents have to make sure that they're out of sight because you don't want the child to be distracted with them. Use simple and easy activities. If you're using a lot of screen sharing, bookmark those activities so that they're easily available to you, and especially for easy transitions for those with short attention spans. If I am uploading a file that is really big, the child might just give up. Okay, this is taking too long. So have those activities bookmarked. Accomplishment of simple activities will give them a sense of achievement, will also give you a sense of achievement. Make the session interactive. Use boom cards. Use books from Epic, coloring or painting apps. I do have a list of some interactive games in one of the following slides, so you can make use of those. The last one. This is a difficult pill to swallow, I know. Sometimes the child may just not be a right fit for teletherapy, and that is okay. If they have to hold off of therapy because in-person is not available at the moment, they might just have to wait. In this case, what can you do to help? Give home programs, give exercises, give handouts. This will help with the continuity of care until they can be picked up for sessions once again. Remember, this does not reflect on your ability as a therapist in any way. So do not hold yourself responsible if something like this has to happen.